Well, thanks, Susan, for that great introduction. And Marcus, always great to see you. Um, we want to have a conversation about everything that's transpired throughout this pandemic. And I think to share a little bit about our careers in nursing and our different pathways. So, when you think about the pandemic and some of the things that you've had to deal with, tell me what's been the most surprising for you in terms of both challenges and both opportunities and also preparation in dealing with the pandemic.
Yeah, and that's I think, a great question. I think one of the most challenging pieces with the pandemic, as you know, I practice clinically as a psychiatric mental health nurse, is I've always understood the stigma that's been associated with mental illness and the lack of acceptance among patients and families when they're faced with a mental health issue. But I didn't really realize the extent of it until the pandemic, in the sorts that inevitably this pandemic's affecting everybody's mental health and well-being in some way, shape, or form. And I think that's also the positive, in that there's more open dialogue and conversation about the impact of mental health on individuals and families, especially healthcare workers who historically have taken on the burden of their patients and their families, but even more so now. So I think it's brought to light the extent of that issue, but also kind of where we're headed. Maybe people will have more of an appreciation for the work that people do in my specialty, is something I think is positive.
Great. And so, we've also been dealing with another pandemic, not just the COVID, but also what I'll call our reawakening or recognition, not just of structural racism, but the white supremacy as well. Mm-hmm. So tell me how that's affected your practice, your outlook, and what you've been thinking about.
Yeah, it has certainly has changed the lens that I see my practice, and I'm sure, especially in nursing education, I see the lens changing, and I'd be curious to hear your thoughts as a dean as well. But for me, I'm biracial. My mother is white and my dad's black. So I've always grown up kind of straddling both worlds. And it really wasn't until I had an experience in the hospital where someone looked at me and assumed, because of the color of my skin, that I was white, and had the audacity to talk about their prejudices and their racist comments towards the people that I work with every day, taking care of people in the hospital. And it was this reignited fire as to the importance of acknowledging, calling out, and having open dialogue about how the issues of racism and discrimination just plague communities across this nation. And I'm beginning to see students, I teach nursing students in community health and psych mental health, and there's a greater interest, and students are beginning to realize the connections that this has to health. So I don't know what your thoughts are, perhaps what you're seeing, and what challenges we're seeing in education related to that.
Yeah, I have to ask you first, though, how did you respond to this person who made that comment to you?
I'm going to tell you, I didn't know how to respond, because that was the first time in my life that I experienced that. And for me, I just reassured that parent, your child is safe here. Your child is actually on the unit interacting with all of our children and all of our staff with no issue. Just trying to reinforce that you have this false belief that your child's in danger because he's surrounded by Black staff members and other Black patients, but he's not. He's being a normal child, engaging appropriately with his peers. So it's really just providing that reassurance that there's no need to let race bother you and how your child's getting care. But I think my response would be, I don't even know what my response would be today, if I was being honest with you, because it's still something that's new for me.
Well, I want to just say that that's really impressive. I mean, you took the focus out of yourself and whatever reaction you had to really hear what the patient family were saying in relation to what their concerns were. So I'm not sure there is a good playbook for how to respond to those. And that's why I was so interested, because I think we learn from each other. So the issues of racism racism period, and the racism in nursing and structural racism are nothing new. And there certainly have been champions that have been trying to address this structurally, personally, interpersonally, on the national level, at the system level, et cetera. What I see as being different is almost, and I want to say a reawakening, or maybe it's a realization of others who are not Black and brown, indigenous, that this is something that's real. And while they may not experience the same types of interactions or understand what that means, I think there's an acknowledgement that yes, it exists, and yes, we need to do something. So there's, to me, I think there's again, a reawakening, or I said awakening, of again needing to address this in multiple levels. So I think there's a lot of complexity, but I think we're asking the right questions, and at least we don't have to convince people that this is a real issue. I think, again, not only the killings of George Floyd, Breonna Taylor, on, was one example, but I think the issues of white supremacy that were so evident on January 6th, I think, is a wake-up call for all of us.
Mm-hmm.
So, Marcus, given where we're at in the pandemic, and you shared maybe just a little bit about your, personal journey around dealing with issues of racism, can you talk a little bit about what got you into nursing and where you are now, and maybe is where you are now where you thought you'd be when you started nursing? And, what do we make of that?
I think for most people, where they say they want to be when they start nursing school is not where they wind up being. And for me, that experience was rooted in being the primary caregiver for my great-grandmother and great-aunt growing up. Both had Alzheimer's, and my aunt had Down syndrome. So having our own little hospital in our living room and seeing the nurses come into the home and their compassion, their respect, and their attention to the dignity of my family and making sure they maintain the best quality of life that they could. And that's what drew me into nursing, the proximity that we have to patients and families, our position within the healthcare system. And what I've come to learn is also our proximity to the community. And that's really what I've fallen in love with. Throughout nursing school, always thought I'd be a gero nurse practitioner. Totally did not go that route. Graduated nursing school with the engagement prize and started working in a homeless shelter in the community to really begin understanding the extent at which some of our most vulnerable are mistreated and not provided that quality of care, which has now led me to psych mental health nursing. So certainly not the journey that I thought, but I think my training and experience in public health and psych mental health has certainly prepared me for a pandemic. I mean, I didn't graduate school saying I'm ready to work in a pandemic, but I think those two specialties lend themselves particularly well for the skills that a nurse and a healthcare provider needs to navigate the issues of a pandemic from a mental health and well-being perspective, and how our community is doing during this time. So how about you? Did you think?
Well, I was going to say, and your journey is not yet done. So I think for, my career was a bit different. So, I am first generation. I grew up in a Latino household and community with three brothers. Talk about gender inequities, but my parents always made sure that we knew that we were always going to go to college. And so, my brothers could, go to liberal arts college and, go and be brilliant. But my parents wanted me to make sure that I had a good job. So it's like, yeah, you can go to college to be a teacher or a nurse. So I always say I made the informed decision of a sixth grader to say, yeah, okay, I think I'll be a nurse. And not having any sorts of experiences in the healthcare field like you did. But once in nursing school, I'm telling you, I fell in love with just about everything that I did, except one thing. I said, I will never, ever be a researcher, never. And of course, that's the first thing that I ended up, not the first thing, but that's what I certainly found a lot of excitement and found one of my passions. But I think, like you, what I found in nursing was a way to engage with communities and people in a way that other people couldn't. I mean, so you have the profession of nursing. And then one of my first jobs was working in a migrant camp where I was the only bilingual professional there. And as like a 21-year-old, I had authority, I had lots of power, and I like that. But people depended on me, to tell them the truth, to help them work through their issues, to help them navigate the greater community, and to be their advocates. And that I found really fulfilling. It took a while before I could find another place or another area in nursing where I could do that. But it was through research, that was community engaged, community informed, setting aside what I thought my priorities were or what my interests were, to really shifting those to addressing an issue that was important to the community. So, as you know, I mean, my research has not only been in developing interventions, but in disseminating interventions. And, I mean, as I mentioned, I like the power that I thought that I has a 21-year-old. I certainly have been humbled by communities who don't care how many degrees I have, or who don't care where I'm from, because until I earn their trust, I'm just somebody else that comes in. So I love the balance of keeping things even. And I think, like you, and I'm going to shift to you in a minute, I've also found out that, again, the more education you have in nursing and other areas, the more tables you're able to sit at to really affect change. And certainly not only getting a PhD, but the credibility in the community, the professional networks I had, gave me a unique position to amplify the voices of my community in national leadership positions, volunteer committees, the National Academy of Medicines, for example, but also in community-based organizations. So I think, again, there's my research, which to me, they're all blended. It's the research that, again, gives me the credibility, gives me the knowledge and the trust on both ends, that allows me, I think, to be an effective advocate to make some of the system changes that we need. I have a sense also, Marcus, that you have also found that, because I think you were active as a student nurse, and I think some of the positions that you have now in the American Nurses Association and on the Future of Nursing 2.0 report, I think also make good use of your talent and your passion. So tell me.
Yeah, I've been very fortunate to have held many leadership opportunities, and like you, be humbled by the people that I'm serving. I think one of the things I've learned in my professional experience is that, especially working with communities, is that the people you serve, the community you serve, are the experts. They are the teachers. They are here to tell us what their needs are and how we can best support them in their support to meet their goals and objectives. And I think that's been the most beautiful part for me, is the collaboration piece of how we can work together to achieve common goals. But in terms of my leadership role, something I've always been interested in ever since I was in high school. Being in professional organizations, I was state president of our Future Health Professionals chapter in high school. And then going into nursing school, I knew I wanted to be involved in the Student Nurses Association and NSNA. And running for the board and being in those leadership positions. And for me, it was always about in nursing school, it was how do we make this the best experience for nursing students? How do we ensure that nursing students' needs are met? And I think my passions in public health and psych mental health were particularly important because a lot of students and friends of mine, felt as though they weren't getting enough education in those areas, that there wasn't enough emphasis placed on particularly community health and public health nursing. And in my roles in the student organization, I was able to say, let's take a pause. Students are interested in community public health. They want to take jobs in these settings. So stop telling us we have to do 2 years in med surg, because we don't. We can go and be effective nurses and advocates in our community. We're just thinking about issues a little bit differently. I don't need to be thinking about the task orientation of walking into a med surg unit. I need to be thinking more at an individual and population level of how does this one person's experience impacted by the determinants when they walk out in their community and why they might be experiencing what they are. And that carried with me through my roles in ANA. and the Future of Nursing Committee. Part of the reason why, I was selected was not only for my experience in public health and psych mental health, but was being the next generation nurse, the next generation nurse leader. And what does that look like? What do nurses today want from their education and from their professional groups? And I've been championing my specialties. And before the pandemic, and the pandemic just gave me even more fuel to say, this is where we're headed. We were already going in that direction. And if this has taught us anything, it's that we need to focus on this more. And that's community public health and psych mental health, because that's how we're going to survive this post-pandemic world.
Well, I think that's really interesting that you share that when what has been of concern to a lot of our students during this pandemic is not having enough patient exposure and not enough time to master, the tasks that they might do, the sexy things like, gosh, why can't we learn how to put an IV in anymore? Because that's not a skill that you need as an entry-level person. But there's still perhaps a sense of, if I don't master these tasks, then I'm not a good nurse. And I think you just confirmed that. And what I believe throughout my professional career is that the skills that we have in terms of listening, our goal, identifying a problem, figuring out a plan, reevaluating it, communicating, those are the skills that we have as nurses that we learn well in school and that carry us in whatever setting that we're in. And that really is the essence, I think, of what makes us different and what makes us special and what makes us valued during this pandemic and beyond. Mm-hmm. So Marcus, what do you think the future holds for nursing? What's your biggest wish? Having lived through nursing school before a pandemic, having practiced in a pandemic, where do you see the future of nursing, and what advice would you have for people who are thinking about, or maybe who are not thinking about, a career in nursing?
Mm-hmm. I think one of the things that has always surprised me is that we have a profession of over 4 million individuals who carry the honor of being a registered nurse wherever they might live and wherever they might practice. But we've never, in my opinion, have realized our worth. That's a pretty large number. And if we come together, we can really do a lot of good change in our local communities and in the nation. And I think one thing that this pandemic has told us is that we already knew nurses were vital to the healthcare system and healthcare delivery. We know that even more so today. We couldn't do any of the things that we do, like put vaccinations in people's arms, without a nurse in a community that's able to do that. So I think one of the things is that people just need to know their worth, need to know the worth of nursing and advocate and find their voice. I was able to find my voice at a young age. But now what I do, now that I know that I have a voice, I try to amplify the voices of others. And I don't think we've done that well in nursing. Bring up our peers and bring up others with us and amplify the greater voice of the profession. And I think we now have the opportunity to do that, especially when it comes to racial and social justice. Again, 4 million nurses in communities across this country. And if we really collectively come together to recognize it's a problem, to clean our own house, and be intentional on how we move forward, I don't see how we can't move the needle there. Sure, there's structural issues, policies and laws and things that are in place that do that, but we're seeing more and more nurses get in positions where they can change that. And they bring with them, like you say, that unique skill set of listening, of diagnosing a problem, triaging that, and developing a plan and evaluating. So I think we're going to see more nurses in critical leadership roles in the future, because now the world knows the power of nursing. The pandemic has certainly shed light on that.
Yeah, there's so many things that I agree with you in that sense. Number one is taking the opportunity that we have as a result of people recognizing the worth of nursing. And what I would hope that we're able to communicate is not just that we're compassionate and that we're brave, which are all important, but we have heads. We are thinkers, we are problem solvers, we are innovators, we can bring people together. And those are the skills that need to be amplified. So we need to advocate not only, gosh, you need to have a nurse on that task force, but you need someone who has X, Y, and Z, and this nurse is the person to do that. So again, as you were talking about pushing or elevating those that we know have those skills and abilities to do that. The second thing, I do think that we need to be strategic about those opportunities that we want to make sure we continue to push. As you know, there's been a lot of relaxing of regulations because the world, our health, because our communities need practitioners who can practice to their full scope. And I think this has allowed many states, the pandemic, to say, all hands on deck. And we need to be able to move that forward and make sure that those changes are sustained. Within our own profession, we need to give it up. There's some things that we absolutely need to give up, things that perhaps were not very useful in our past, things that we never had evidence for, and to, again, rework ourselves so that we can truly be addressing the needs of what our communities have, and whether that's taking a look at how we address racism in the curriculum, whether it's an issue of looking at the content that we teach, whether it's again from our regulatory agencies, thinking about what are the requirements to certify advanced practice nurses. There's lots of questions in what we do, and we have to be introspective of that, but with the focus of how is this going to help us better serve our patients, families, and communities moving forward. So we have work to do. I absolutely believe that we're up to the task, and I'm so excited to always to engage in conversations with you, Marcus, because it gives me great hope for our future. So thank you.
Well, thank you. It's always a joy and a pleasure talking with you as well. Being that inspiration for what a nurse leader looks like and how and inspiring others to take on that role. So you certainly are a role model within the profession and within our community, because people see themselves when they see you. They think, wow, I can be something. And that's what we need to be for a lot of people. I was a first generation student, single parent household, and I didn't have those people to look up to. And so that's very important to me, the mentorship and being, as Gandhi says, being the change you want to see in the world. And that's what's important to me too, is making sure that those that come after me have the same opportunities, if not more, that afforded to them. So I thank you for being that shining example as well.
Well, thanks, Marcus.